Well, welcome. My name is Nicole Dutra, and I'm a senior project coordinator for the Program and Partnership Development Department at the National Environmental Health Association. I am also the administrator for NEHA's Private Water and Decentralized Wastewater Program Committee and administrator for the Private Water Network. I hold a bachelor's degree from Arizona State University in Global Health and a master's in Public Health from UC Berkeley. And I have the pleasure of being your host and moderator for today's forum. With that, allow me to cover a few housekeeping items before we get started. Please note that the seminar is being recorded and will be made available on NEHA's website. Please use the Q&A option to submit any questions that you may have throughout the forum. You should see the Q&A option on your Zoom screen. At the conclusion of today's forum, you will receive a link to take part in an evaluation survey to provide your feedback and comments. Let me review the agenda with all of you. In this first session, I will be going, first I'm going to give some acknowledgement to our Private Water Network work group, who has been working with me since December on putting this forum together. I will share with you what the learning objectives are for today. I will share some news about the Private Water Network, and then I'm going to go over some key takeaways from the Private Water Network SWOT analysis that was conducted. After that, we will have a special presentation, a private well data management system, strategies and challenges, and you will have the opportunity to ask some questions of our speaker. After that, we will go into a resources session where we have planned several partners of the Private Water Network who are here today to share some great resources with you. And we will have a little session, a little time for you to be able to ask them some questions after. And then after that, I will do the closing session with all of you. Here's another poll for you. Which group do you best identify with? So are you government sector, private industry, academia, nonprofit? On your cellular device, I'm sure you could scroll up and down. There's quite a few options there for you to pick from. It looks like government sector is very high, many of you. All right. We have some nonprofit, academia, thank you, and self-employed, thank you. All right. So before we continue, I would like to take a brief moment to thank our Private Water Network subscribers who volunteered to take part in the work group and contributed greatly to the planning and logistics of this event today. Diana Rashash from Arapahoe County Public Health in Colorado, I'm sorry. Tom DeBell from Vermont Department of Health. Mary Beth Brown from Franklin County Public Health in Ohio. Amanda Goff from Tennessee Department of Health. James Rada from Jefferson County Public Health in Colorado. And of course, Raquel Sabagel from the Centers of Disease Control and Prevention, National Center for Environmental Health, Water, Food, and Environmental Health Services branch. Thank you for your commitment to making this a purposeful and engaging event. Now, let's review today's learning objectives. By attending today's forum, you should be able to summarize the strengths, weaknesses, opportunities, and threats reported by environmental public health professionals who specialize in the fields of private water and onsite wastewater. Express the importance of data collection and the benefits data contributes to decisions and practices that improve public health. Apply the effective communication methods shared during the presentation when engaging with community members regarding private well and/or on-site wastewater assessment results, data, and/or follow-up recommendations. Compare and contrast the practices shared in the presentation related to private wells and on-site wastewater data systems to your agency's practices to identify any gaps and opportunities for improvement. You should be able to identify and share available resources with colleagues in the field and or community members who have private wells or on-site wastewater systems. Next, we have poll question number 3. Which of the following best describes your current job role? Looks like we have environmental health specialist slash engineer leading the way, regulatory, environmental consultants, on-site wastewater specialists. Wonderful. A very diverse group. Thank you. Next, allow me to provide you all some information about Private Water Network and some new news. NEHA is beginning our 6th year of hosting the Private Water Network. The network is a federally funded program which has gained much support since its inception and continues to capture attention and the respect of those working at the many different levels of government, the private sector, academia, the public population, and more. Some of you may be curious about who all make up the private water network. Well, that's all of you, environmental public health professionals, those that work in private wells, on-site wastewater, soil scientists, those that study groundwater hydrology, deal with water quality, and other related specialty professions. And of course, we have academia, private sector, homeowners, even international environmental public health professionals. Our purpose is to provide a community for like minds to come together for collaboration, networking, building partnerships, sharing training opportunities, providing advocacy support, sharing resources and tools, and help with solution-based problem solving, and so much more. Now, let's quickly take a look at the road taken. As some of you may know, the Private Water Network was born through the work being done by CDC's National Center for Environmental Health. From the Environmental Health Specialist Network that began work on water-related research and practice in 2005 to the Private Well Initiative that kicked off in 2010, the initiative's goal was to address risks associated with unregulated drinking water systems or private wells. They created a national network or work group where stakeholders could come together to discuss issues with private wells or small drinking water systems. Also, overlapping in that time frame were two short 2-year projects focused on capacity building around available data for private wells and describing the issues related to obtaining and using that data. In 2015, CDC held the Baltimore workshop, which focused on understanding the then current and emerging challenges with private drinking water sources. Also in 2015, the Safe Water for Community Health, or Safe Watch, as many of you probably know it, was a cooperative agreement that provided funding for in-depth assessments for 14 states and 5 local jurisdictions' drinking water programs, and the funding to improve their programs based on the identified opportunities, which aligns with the environmental public health performance standards. CDC, understanding the need to drive national engagement, and while the Safe Watch program was still underway, they held a partner meeting to get feedback on designing a network for the environmental health practitioner focused on strengthening private well programs. So in December 2019, with substantial input from Safe Watch partners and under the guidance of NEHA, the Private Water Network was established. The original community platform was housed on WordPress for a time. Then at the beginning of 2024, as some of you may remember, we transitioned the network to the NEHA community on TradeWing, which has served us well. And lastly, we find ourselves at the end of this timeline at today's inaugural open forum. Some news I am thrilled to share with all of you today is that as of close of business yesterday, The private water network has a total of 635 subscribers. This group has achieved the fastest growth of any group I've had the opportunity to work with. At this time last year, we only were at 194. So that's about 320% growth in just a year. So thank you to all of you for being here and for your passion for the field. And we will continue growing and focusing on the journey ahead of us. Another poll question. So what contaminant of drinking water have you found to be of most current concern in your area? Is it arsenic, lead, radon, nitrates, or something else? Please type in your answer and you can submit more than one. PFAS, arsenic, nitrates. So many. Radon, uranium, coliform. Thank you. Thank you for submitting all those. Lead, E. coli. Got it. Manganese. All right. Thank you so much. Next, allow me to share some results from the Private Water Network SWOT analysis that was conducted starting December 11th, 2024, and continued receiving responses through February 12th. So for the Private Water Network SWOT analysis, we received 59 responses from 30 of 50 U.S. states, which provided very detailed, thorough information on their specific program strengths, weaknesses, opportunities, and threats. This map shows that distribution by region. Now, let's look at some of the collected data. This table shows identified distinctive themes by U.S. region. This one shows the West and Midwest regions. We found the regional breakdowns to be very valuable as they show how environmental public health agencies face different challenges and opportunities depending on their geographic location, which suggests that tailored approaches may be more effective than a one-size-fits-all solution. Allow me to point out some key points from these SWOT profiles. The West shows several distinctive strengths compared to other regions: program management, regulatory framework, funding and resources, and even staffing and expertise. Western states face particularly significant shortfalls and challenges in staffing and capacity, which refers to severe staffing shortages, which came out dramatically higher than the other regions, as well as in community education. The West region opportunities for improvement include primarily technology and data systems, although education is also a significant need. Other opportunities identified include initiatives around water conservation, funding, and policy improvement. The threats that the West region respondents relayed were development pressure, which was identified as something dramatically higher than what was relayed across the other regions. And public perception seems to be a worry as well, in addition to climate change, which 10% of respondents relayed as a threat. And then funding cuts, political pressure, and staffing challenges were also relayed. Now let's take a look at the Midwest region. Midwest programs particularly excel in regulatory framework, funding, and resources, and the Midwest is also strong in environmental protection. Midwest weaknesses are more evenly distributed with no single standout issue, although each of these carry quite a bit of concern: program administration, community education, environmental challenges. 35% of respondents for the Midwest relayed generally the same feedback. The Midwest shows a balanced emphasis across multiple opportunity areas like technology and data, funding, education, and policy improvement came in among a significant percentage of respondents. And the threats faced in the Midwest include funding cuts, which 29% of respondents identified, public perception, which is 15 points higher than the national average. Political pressure is being seen as a significant threat, as well as staffing. And again, this would refer to staffing shortages. Now let's take a look at results for the Northeast and the South. Allow me to point out a couple key points for the Northeast and South. The Northeast has a single standout strength, which is community engagement. It came in 41 points higher than the average nationally. But I will note that emphasis on technical and administrative strengths was much lower. Northeast programs struggle primarily with community education, which provides clarity on why community engagement is so high. Looks as though an action plan has already been implemented there. Notably, no responses mentioned staffing, technology, or collaboration weaknesses. Respondents from the Northeast region relayed their opportunities lie in policy improvement, which we find significant as it came in 20 points higher than the national average, collaboration and education, and there seems to be minimal emphasis on technology or funding opportunities. Northeast region shows a more balanced distribution of threats, which include funding cuts, political pressure, and public perception. The South region, their distinctive strengths are technology and data, which came in 15 points higher than the national average, and staffing and expertise, which was 11 points higher. The South also shows a good balance across multiple strength areas. On the flip side, the South also faces multiple significant challenges. Although technology and data shows as a significant strength, 50% of the respondents relayed they continue to face substantial gaps, making this also an area of considerable weakness as well. Program administration was relayed as a weakness as well by 50% of respondents. Staffing and capacity in the South is also a weakness. Again, this would refer to staffing shortages. And funding constraints seems to be an issue they are facing as well. The South's opportunities include staffing and workforce development, which came in 23 points higher than the overall average, technology and data, and education. The threats for the South fell in line with other regions, with funding cuts leading the way, but it was the only region where staffing shortages and system aging came to light as threats. Next, we will take a look from a national perspective. So this table shows the top 8 national key themes that were captured from the responses under each of the SWOT categories. I'm going to proceed by sharing some key observations. Program management paradox. Program management appears as both a top strength and a significant weakness, suggesting considerable variation in program administration capabilities across agencies. Resource impact gap. While funding and resources are frequently cited as weaknesses and threats, they're less commonly mentioned as strengths, indicating a persistent resource challenge across the sector. Workforce dynamics. Staffing appears consistently across all 4 SWOT categories, reflecting both current capabilities and ongoing challenges in maintaining adequate workforce capacity. Environmental focus consistency. Environmental quality appears with similar frequency across strengths, weaknesses, opportunities, suggesting widespread recognition of its importance regardless of current performance. Technology and transition. Technology and data systems are more frequently mentioned as opportunities than as strengths, indicating recognition of digital transformation potential that has not yet been fully realized. Now, some underappreciated areas to note include collaboration potential. While interagency collaboration is only moderately mentioned as a strength, it represents an underutilized opportunity for addressing resource limitations through partnerships. Political factors. Political considerations uniquely appear as a significant threat, but are rarely addressed in opportunities, suggesting a reactive rather than a proactive approach to political engagement. Public perception gap. Despite public outreach being a common strength, public perception remains a significant threat in many regions, indicating potential disconnects between outreach activities and effectiveness. And some points for implementation consideration include system aging. While not among the top national threats, system aging infrastructure appears as a regionally significant concern that may require increased attention in coming years. Professional development needs. Expertise and training appear more prominently as strengths than weaknesses, but this may mask important regional variations and specific skill gaps. Regulatory Balancing Act. Regulations and policies are viewed nearly equally as strengths and weaknesses, reflecting the dual nature of regulations as both protective frameworks and potential implementation challenges. Data-driven decision-making. The emphasis on technology and data systems as opportunities suggests growing recognition of the need for evidence-based approaches, though implementation readiness varies widely. Hopefully, these observations provide you all some insights that highlight interconnections between the different SWOT elements that could be valuable for each of your programs. Private water and on-site wastewater programs across the U.S. face both significant challenges and promising opportunities. The feedback from environmental public health professionals highlights the critical importance of these programs in protecting public health and environmental quality. Based on the SWOT analysis, we have built out 5 recommendations for strategic priorities. Strengthen workforce capacity. Develop recruitment and retention strategies. Invest in staff training and professional development. Create succession planning for institutional knowledge preservation. Number 2, enhance financial sustainability. Explore diverse funding sources, including grants and fee adjustments. Develop cost recovery models that ensure program stability. Advocate for dedicated funding streams for water quality initiatives. 3, modernize regulatory frameworks. Update outdated regulations to address emerging challenges. Harmonize regulations across jurisdictions where appropriate. Strengthen enforcement capabilities and compliance incentives. Number 4, leverage technology and data. Invest in modern data management systems. Improve data collection, analysis, and reporting capabilities. Use technology to streamline administrative processes. Number 5, expand public education and engagement. Develop targeted outreach strategies for property owners. Create accessible educational materials on water quality issues. Build partnerships with community organizations and stakeholders. By addressing key weaknesses, leveraging existing strengths, pursuing identified opportunities, and mitigating potential threats, these programs can enhance their effectiveness and sustainability in the years ahead. Next, allow me to introduce our guest speaker, Amanda Goff. She is a senior environmental health specialist in the Waterborne and Zoonotic Disease Program at the Tennessee Department of Health. She manages the private well Safe Water program, sits on the Water Quality Oil and Gas Board, and serves as a subject matter expert during waterborne outbreak investigations and disaster response. Amanda has over 7 years of experience in environmental health with the state of Tennessee and received her bachelor's in microbiology from Tennessee Technological University. Thank you, Amanda, for being here, and I pass the floor to you.
Thank you, Nicole. We just had one quick question from Aaron that I'll answer really quickly. How does the program management differ from program administration? Strength in one, weakness in the other. When that questionnaire went out, it was an open-ended question. So some states refer to it as administration and some refer to it as management. So it's kind of interchangeable, but when it was submitted, both of those terms were used interchangeably, if that answers your question, Aaron.
Thank you, Amanda.
And um, as she said, my name is Amanda Goff. I'm with the Tennessee Department of Health. I am our subject matter expert for waterborne and zoonotic disease for the state of Tennessee. Previously, I was a health inspector before moving in this role, and I do have my REHS RS. So if you want to go ahead and go to the next slide, Nicole. Um, and these, just to highlight, these are my counterparts within our lab that I work very closely with this program. And I just wanted to provide their information. So that way, when this is made available, if you all have any lab specific questions, you can feel free to reach out to them as well. So our program started in 2015. We did participate in the pilot of Safe Watch, and Tennessee, as with most states, does not regulate the routine testing of well water. And that was something that we felt was necessary and garnered. So my division is actually housed under the Communicable and Environmental Disease and Emergency Preparedness Division within our state. And our initiative as of 2023 started with a new method of sending out kits, and we were doing it by mail. So, and it has been very successful. Nicole, if you want to go to the next slide. In the beginning, a lot of our Safe Watch program was aimed to reduce exposure from private unregulated drinking water sources, mapping private wells and water sources such as springs that were not previously identified because of the age of the spring or water source when our environment conservation counterparts started permitting the new drilling of those private wells. And we do work in partnership with a lot of our university partners as well as our nonprofits. So as part of that development of this program, we have developed flyers that go out to the communities, postcards, some social media reminders for folks. And part of the money that we do receive from CDC for this program goes towards these kits that we mail out, and they return to us directly to our state lab.
And now we have another poll for all of you. What methods do you typically use for collecting data in the field? Select all that apply. Physical samples. Field observation. Mapping. That is great. All right, go on, Amanda.
Perfect. So the testing methods that we do use are developed by the EPA, and our state laboratory is accredited and certified. Um, for the best cost, I know some states do use specific counts for coliform. Unfortunately, for cost benefit and to reach the most people, we do use an absence presence testing method versus a quantitative method. We also do run everything through StarLims, and if it flags any other contaminants of concern, my lab folks do reach out to me on a case by case basis to ask me if I want to go ahead and process it for it if it's flagged. So, we have a generic that we will test for, but there is also room for if something else is identified, I can go ahead and request that that be tested so I can notify the private well owner as well. So, our system started with using basic Excel. There's a bunch of spreadsheets and things of that nature coming from different sources, and it was kind of hard to manage. So we introduced using RCAP in 2022, and through RCAP, we are able to build and have a single point where I'm able to go in and view all of the results within the system. So this is just a general open of what our initial form looks like when we began the RCAP project in 2022. Previously, this is what our forms in Excel looked like. So it was a little bit messier and harder to see.
Yeah, we have another poll question for the audience. What types of data do you typically collect when working in the field? Select all that apply. A little
Looks
bit
like
of
everybody is very
everything.
busy.
Wow, yes. Thank you for that information, everyone. Wow.
So in reviewing our program within RCAP, this is what our basic form entails. So I can put in the referral date, um, when they were referred, who they were referred by. Some people contact our lab directly for kits to be shipped out. Some people contact their local health department. If we get something from our nonprofit, we can put it in there. If I get the request from our end for, say, a healthcare related situation, I can note that as well. I can also choose to put other in there. And so that way, if I follow up on like a high lead result or something that is abnormal, I can submit and link a new referral to this original referral for review. So in this form, there will be a PDF available of it in the resource section. So if you have further questions, or if you all use RCAP and would like to have some of our code or our library code, feel free to reach out to me and I'd be glad to be able to share that with you. This is also something I can update, and I do update regularly. But since I am the only one in our team, as far as staffing shortages and things go for the entire state, I manage this database. So this makes it a lot more easy with staffing shortages for me to be able to communicate results and also communicate with the lab and the lab actually is the one that mails these kits out direct to the well owners and receives them back to start processing. So it does also, you can go on to the next slide, Nicole. So if for some reason there's something wrong with the sample, whether it be holding time or something of that nature, I do have it to where I don't have repetitive repeats and have to build like a whole new account for each one. I'm able to account for those things. And also in this, it allows me to monitor and stuff for billing as far as our grant funds and stuff of that. So I do manage a lot of things multiply within this system. So within this system, I have also provided for the resource section samples of our automated emails that go out to the well owner participants so that I also don't have to reach out to them individually for each automated result. So that's what this is. And I set those notifications up. So when I click a certain button, it says, have results been, when the results were communicated to the owner, it will automatically send out that results notification, and it automatically attaches a copy of the lab certified results as well with the email that goes out as an attachment. And then within those emails, there are also links for them to be able to understand those results as well, and includes resources in those links as well.
That's pretty amazing.
So this is an example of most recently how I'm able to filter and pull specific results. So I can filter it out to pull it just on the record ID. If I'm looking at it on a county by county basis, what the lead result was and the date that I got that result from the lab. That way I can remove any private or protected information from the result. So that way I'm able to share it with academic counterparts if they're doing research or things of that nature. And then this data can also be transposed into GIS, ArcGIS, Tableau, things of that nature, so that you can get a better picture of what's going on geographically within your state and within your area. And this also allows, you can go ahead and go to the next slide, Nicole, for us to be able to track what's going on. So for instance, these initial GIS models that we did were from the original 95 tests that were completed from September 22nd or September of 2022 through June of 2023. And all of these results were communicated by contacting the well owners directly. Go ahead to the next one. And so this is just a different way of looking at it. So when we're able to see these kinds of results, this allows us to go out and work more readily within those communities that lie in these highly positive or prevalent counties. So say, for instance, Williamson County, we can work with that local health department. We provide kits that people can pick up at their local health departments, as well as information and guidance as far as that goes as well. You can go ahead to the next slide. This just also shows copper hits, and the next slide should show total dissolved solids by county.
Thank you, Amanda.
Absolutely.
Audience, we have another poll question. What methods do you use to record and store the data collected in the field? Select all that apply.
Awesome. It looks like they're all over.
Yeah.
Traditional paper. I have noticed in our industry that that has become more of a hardship as well because it is hard to, not every agency uses the same form of documentation. So it can make it very difficult to
Mhm.
get um, data across agencies versus EPA versus CDC. There's no commonality. And that's a lot of the things that I run into with, we could find a lot more outbreaks and a lot more issues if we had something that was more um, across the board. So
Yes.
we have also used our environmental health specialists that go out and do our restaurant and health inspections to attach one page informatics at the ends of their inspection reports that get sent out to the owners and operators there. And that has been great to get public awareness for certain things out as well. So there's a lot of options out there.
Yes.
So to summarize those first 95 tests that were done, um, none resulted high over the federal limit for fluoride, nitrate, or nitrite. Um, we did have two locations that had large hits for sulfate and for chloride. Lead, that were just two in those original 95. You saw that's kind of grown a little bit. And all of our arsenic results is usually just in East Tennessee area. They were all below the federal limit of that. Next slide. Some of the limitations for our program is shipping cost, holding times, temperature of samples. Not all kits sent out were returned. Aaron, to answer your question right here in this, we do follow up if we haven't received the kit back within a certain percentage of time to ask them to go ahead and ship it back to us, because we do include a return shipping label in there so that we can get it within that 24-hour hold time for the total coliform and E. coli testing. So to answer that question, um, we get about 75% of them returned back to use. So we've gotten a better success rate as time's gone on and word has spread. Since July of 2023, 195 tests have been completed, and that was just as of a couple of weeks ago. So it's actually gone up more since that. The things that have really helped with a lot of this data is that it has immensely benefited us when we did the response for the Hurricane Helene flooding in East Tennessee, and being able to communicate with the communities and follow-ups. I can automate surveys to go out to these people that have provided us their email addresses to do follow-up information with them, which is great. So I am currently in the process of working on for a strategy for one of our grant proposals. And we also have the ability, because of using this system, we have food core and things of that nature. So I can go in and see if there have been any foodborne illnesses or waterborne illnesses that could be linked to a private well or an outbreak or mass gatherings, things of that nature. I can pull those reports so I know if I need to send education guidance to a specific area, specific health department, um, things of that nature. And if you want to go ahead to the next slide.
Oh, we have another poll question, Amanda. Sorry about
Gotcha.
that.
Oh, you're good.
Please select up to three reasons in which you mostly utilize data. Policy development, infrastructure planning, educational purposes, regulatory compliance, environmental monitoring. The data is being used for several different initiatives. Okay. Thank you all.
That's great. So just to go back to the Hurricane Helene response, this allowed us to work interagency efforts with our environment conservation counterparts. And they were able to pull parcel data and driller data where they had permits and stuff for new wells within the flood zone that was impacted in the emergency declared counties. And there were roughly 30,000 private well owners that were impacted. So you can imagine there was one of me and our environment conservation. There was only a few of them, and they were dealing with more critical infrastructure failures at some of their wastewater and advanced water treatment facilities. So it allowed us to come up with an alternative solution. And we had some at-home test kits for total coliform bacteria that we had used previously during COVID. And so I had those shipped out to East Tennessee and they were distributed. We had some great feedback from it. And so those, you can go ahead to the next slide. We were able to develop guidance before the CDC put out their guidance, EPA put out their guidance, things of that nature, to provide to the public along with these kits. And we did it in English and Spanish based on feedback from those communities and how to read those. My contact information was provided. So if they had questions or weird things that happened, they could contact me directly. And we also provided guidance documents on emergency sanitization, things of that nature. So with this happening, I can now go back and filter some of my results within the REDCap system for those specified counties for that specific time range. And then I can get data over time. So I can look at it if I got a bunch of positive E. coli hits right when the flood happened, and then I can look at it a year later because a lot of these homes are in low income areas and rural areas. Some of them use the same aquifers. So I can see if there's a trend or a pattern that may need to be addressed moving forward in the future. And that allowed us to alleviate some of the stress from our state public health laboratory for other contaminants and things of concern that came up, and they weren't bogged down with a bunch of private well tests and stuff as well. So we were able to give them something that they could use and be proactive and reach out to us, as well as we reached out to a lot of the local labs that they used to make sure that they had some reduced pricing and stuff on total coliform E. coli testing, things of that nature. We also provided them with a list of those that, they could also reach out to and use that were private. And so it was actually really successful. So we were actually able to go through TEMA, and TEMA was able to order 3,000 of these that we were able to distribute and pass out from multi-agency resource centers, as well as the local health departments for use.
That is pretty great, Amanda.
And these are just some of our resources from our health department side. We have some of our guidance documents and things of that nature, as well as linked to some of the CDC. So if you all are curious about how we set that up, feel free to check those out.
Great. Amanda, we have a couple questions and a comment for you. Aaron said that's great that you get 75% back. We distribute kits in Maine through our Women, Infant, and Children program, but only get 30% back. Anything else you do to encourage people to return it?
Some of those programs I started, depending on the number that I was getting, I would reach out and give them a call first to make sure, hey, did you specifically want this kit? Do you want it tested? Is this the right, address? Some of them may have said yes in the midst of being asked a bunch of other questions. So I just reconfirm that they want it. If we haven't received it back within a couple of months, I do reach back out to them and say, hey, we sent you the kit. Did you have any problems? Did it not get to you? Things of that nature. So it kind of helped alleviate some of those other problems and also making them available at our local health departments. That staff there works with our lab really well, and being able to communicate with those private well owners so they can follow up there as well.
Great. A comment from James, great information to justify water line extensions or grants. Thank you, James. Anthony asked, what is the brand name for this coliform test?
I believe it was back tea.
Bacti. Okay. And what were the in-home test kits used for bacteria?
Yeah, that was the back tea. So,
Okay.
and the reason we did that was because they could be done at room temperature. It had the additive already in there for the color change. So all they had to do is shake it up, leave it sitting on a counter at room temperature for about 48 hours, and they would get a result because a lot of those people were without power as
Mhm.
well. And so, or refrigeration, I should say, they got destroyed. A lot of those private wells wouldn't work without power, but that was a double, some of them had generators. So that kind of helped get around some of that too, with having to refrigerate those. And we couldn't get FedEx or staff to some of those areas. So it was a quicker way to get
Uh,
those out to them.
I see. All right, another question. It looks like the kits you used did not require the consumer to return them, but instead the testing and interpretation was done in the home by the consumer. Is that correct? Was there any attempt to gather the results from all this testing for your own internal use?
So when we tried this with COVID, we didn't get a lot of feedback. We tried to do it with the QR code to get feedback, and there just wasn't a lot because it was for at home use. So um, we were doing it more for the public. I was able to collect data from the people that did call in and ask questions about the kit and color changes and things of that nature. If they had problems, some of them were home filtration system issues. It brought up a lot of good points about landlord versus tenant issues and well maintenance. Because the tenants would have a hard time getting the landlord to treat or
Mhm.
um, take care of the well post these problems. So, no, it was really hard to be able to get that data, and it wasn't from a certified lab, so it wouldn't have been consistent enough to use. So, we just took it as did they find it helpful? And we were trying to reach the most people that we could in the most timely fashion that we could.
Let's see. All right, Katie, I have a question. Did you have any concerns of incorrect results if the homeowners did not follow the instructions properly?
No, like I said, I mean, I had, I think, one call where they got a test kit that there was no powder in it. So it was a manufacturer defect. They got another one. Some of them said that they had an orange color change. So it wasn't quite purple, wasn't quite yellow. And so in some of those instances, it had to do with like a home filtration system. So they didn't change their filters and things of that nature. So, I recommended, again, sanitizing, evaluating their well, and changing their filters because some contaminants from the flooding could have been caught in those, and then retesting. Um,
Okay. And Daniel asked, did the tests give exact numbers related to results other than just a positive versus negative?
no, it's just an absence presence for total coliform,
Uh,
because the thought behind that was you can't have E. coli present without total coliforms being present.
mhm.
And from a health perspective, no, any amount of bacteria isn't considered a safe amount of bacteria. So that way we were promoting people treating their well and getting the resources out to them as we could.
Sounds like a good plan. Great. Well, thank you very much, Amanda, for your presentation. That was wonderful. And next, I will introduce our resources session moderator. Tom DeBell from the Vermont Department of Health. He's an environmental health engineer, and he will be leading the resources session for all of you.
Thanks.
Tom,
Yeah,
floor is
thanks,
yours.
Nicole. Yeah, and good afternoon, everyone. Thanks, Amanda. That was a super interesting presentation. Definitely gonna compare notes with you after this to see what kind of things we can implement in our program. But yeah, we've reached the section of our program today where we're going to highlight some great resources from different partners of the private well network. We're really fortunate to be joined today by some great leaders across the private water community, speaking about their organization and highlight some of the great things they do that they can offer folks. Up first, we'll have Andrew Nordby. He'll be speaking about the Rural Community Assistance Partnership, or RCAP. Charlene Bean and Elizabeth McLean will be presenting on the Water Systems Council, the Well Care Program, and the Water Well Trust. And Steve Wilson, if he's here, I haven't seen him yet, will also be talking about the private well class. And depending on if there's time, I'll also give a little rundown of some of the resources the Vermont Department of Health has available for you all to reference as well. But with that, I'll hand it over to Andrew. Go ahead and take it away.
Thank you so much, Tom. Yeah, so just a little bit about RCAP. If you're not familiar, we are the Rural Community Assistance Partnership Incorporated, a national network of nonprofit partners working to ensure that small, rural, and tribal communities have access to resources, tools, and technical assistance that create capacity and opportunity for increased rural prosperity. So we have 6 RCAP regions there on the map across the United States and the different color patterns there. And we work in every state, Puerto Rico, U.S. Virgin Islands, and the Pacific Territories as well. And one of our grants we work with the Environmental Protection Agency through is the private well program. So we've been working on it for many years now. We're currently working on one. I don't know if you have the brochure I sent over pulled up, Tom. We can go to the second page on it if you do. If not, that's okay too.
Yeah, it'll be sent to everyone after. I don't have it on the slide deck though.
Okay, sounds good. That was a brochure that we produced a little while ago, a one pager on a prior grant. But through our private well program, we're also partnered with a few other organizations. Currently, we're partnered with NEHA, National Environmental Association. We're partnered with NGWA, National Groundwater Association. We're partnered with TAMU, Texas A&M University Extension Office. And then Steve Wilson, if he presents today, we're partnered with the University of Illinois and their water extension office. So that is a great network. We're spread out and we do a lot of work across the country. So the main few things that we do are well assessments for homeowners. On the ground, we go to the homeowners' houses and we do a well assessment and inspect it. There's a well assessment tool that was developed in conjunction with the University of Illinois many years ago. And we also supply well test kits to these well owners now so they can figure out and take action on recommendations that our well assessment suggests. Along with that, we do trainings and workshops for private well homeowners, as well as trainings and workshops for professionals and stakeholders. This program also supports privatewellclass.org. It supports webinars, self-paced e-learnings, podcast brochures, a hotline, a national hotline that the University of Illinois hosts and is posted on the EPA website. So there's a big variety of things that our private well grant does, and it has grown over the years. In the current program we're working on, we're doing about 650 well assessments across the country in at least half of the states. It varies year to year on the state reach and territory reach that we hit, but we do at least half of them. And then most of those have well test kits supplied And then as far as trainings go, we put on about 12 trainings for homeowners, uh, three well owner trainings for tribal homeowners, and then 15 trainings for stakeholders, private well professionals, environmental health professionals. So those are done all over the country. So that's a little bit about what RCAP does in the private well sector. And feel free to ask questions, reach out. I do have to jump off right after this, so you're welcome to email me and follow up um, with any questions you have. So, uh, yeah, thank you for having us on.
Hey, Andrew, real quick question
Yeah.
for you. How would a state local agency go about setting up training for local well owners with you guys?
Yeah, you're welcome to reach out to me and I'll connect you, depending what state that is, with the appropriate person. And as long as we still have funding available to do one, it would likely be something we could do.
Yeah, thanks, Andrew. I think that's really great. I know in the Northeast we work really closely with our RCAP group. We do a couple trainings with them a year, and it's a great partnership. They're really a nice resource to have, kind of boots on the ground out in the field, which is not something at the health department we can do. So great resource.
Yeah,
Thanks for talking about it.
glad to
Um,
hear it. Yeah, and my email is anordby@rcap.org. But
and
yeah,
we'll
we
share
can.
that too out for you, Andrew.
Sounds good. Thank you.
Thank you so much, Andrew, for being here.
Of course. Thanks, everybody.
Great. And I think next we have Charlene and Elizabeth.
One
Talking.
second, there's a poll that
Oh,
jumped in.
you're
Poll
right.
jumped in. Another
Perfect.
poll for the audience. All right. In your role, do you directly engage with members of your community who have private wells or on-site wastewater systems? Yes, look at that. Good to know. Great. Wonderful. Thank you, everyone. All right. Now back to you, Tom.
Great. Yeah, and it looks like we found our right audience. It's great to see those results. So yeah, up next will be Charlene and Elizabeth talking about a lot of their great work that they do with the Water Systems Council, the Well Care Program, and the Water Well Trust. So the floor is yours. Thank you.
Thanks, Tom. I am Charlene Bean. I am the Well Care Program Supervisor for Water Systems Council. I manage our well care program, including the Well Care Hotline. If you could go to the next slide, please. For those of you that don't know Water Systems Council, we are a national nonprofit established in 1932 with the initial mission of introducing electrical pumps to domestic and agricultural wells. Today, our mission has grown to support all private well owners and small shared water systems. We are dedicated to ensuring well owners have access to safe and reliable drinking water, like all of you, and supporting the water well industry. We work with local, state, and federal agencies to protect groundwater. Ooh, the slide is, if you could go back to the slide.
Sorry.
Thank you. That's okay. We work with local, state, and federal agencies to protect groundwater and educate the importance of water well systems. Okay, next slide, please.
Thanks.
Our well care program is a major driving force of making this happen. Our program provides national level information and resources on wells and well water. We connect well owners with local professionals and ensure they receive region specific guidance for maintaining their wells. A key part of this program is our Well Care Hotline, a toll-free resource available Monday through Friday from 9 a.m. to 5 p.m. Eastern Time. Our hotline is open to anyone in the U.S., and we even receive calls globally. We handle questions on wells, well water, septic systems, cisterns, spring-fed wells, and more. We do have our Well Care Well Owners Network, which is a national network that provides well owners with seasonal maintenance tips through our quarterly newsletters. Another vital initiative is our HELP program, which offers emergency preparedness and response information for well owners affected by disasters like wildfires, hurricanes, flooding, and winter storms. We have website resources that include interactive map. Our interactive map for local agencies, water testing resources, well professionals. We also have our interactive well diagram. Sorry, learning modules. I'm having some internet difficulties. Our learning modules are available. We have over 100 information sheets, brochures, and of course our well owner's manual. Next slide, please. Some more details about our well care hotline. We've been supporting well owners for over 20 years. We have a small but dedicated team that provides live phone, chat, and email support. On your screen, oh, I'm sorry, next slide, please. On your screen, you'll see the contact information for our hotline, including our toll-free number, website, and email address. Our live chat is available during business hours and by filling out our form if it's after hours. Next slide, please. Our Well Care Well Owners Network was established back in 2009. We have everyone from well owners to manufacturers and contractors, plumbers, and inspectors. We encourage everyone to join and to share the resource. Members receive seasonal newsletters, access to well water testing discounts, and additional social media support. You can sign up for our free newsletter on the website that's on your screen and follow us on Facebook, X, and YouTube. Next slide, please. And for more information on our programs, you can contact, of course, our executive director, Margaret Martins, and the details are there. Water Systems Council is also active on LinkedIn, Facebook, X, and YouTube. So feel free to join us there for the latest news. And with that, I'll pass it over to Elizabeth with the Waterwell Trust.
Thank you, Charlene.
Sure.
Waterwell Trust was established in 2010 when members of water systems councils were seeing a consistent number of rural homeowners not being able to access public water utilities in an alarming rate utilizing contaminated water sources. There are many excellent organizations working to provide safe drinking water to provide to people in developing countries, but very few opportunities for those living without water right here in the United States. Next slide. Waterwell Trust focuses on rural areas where public utilities are not available to homeowners and honestly is not cost effective to invest in the infrastructure. Next slide. Waterwell Trust has been administering USDA funding since 2014, which is currently known as the Rural Decentralized Water Systems Program, or DWS. This funding was established to help individuals with low to moderate incomes finance the costs of household water well systems and individually owned decentralized water systems. An eligible homeowner can access these funds to construct, refurbish, and service their household water well or decentralized wastewater system up to the point entry of the residence. Basically, we can help with anything outside of the home. Most will qualify for low interest loan, which is a 1% interest rate, and we can loan up to $15,000 per project. Terms can be up to 20 years to repay. So an example of a payment of this would be $68.98 a month. Payments would begin the following month after the project is completed. We issue payment directly to the contractor. We do have grants available to those that meet the criteria. Next slide. To be eligible, the homeowner would need to meet the following criteria. Household income, unfortunately, does not factor in the number residing in the home. Any income is counted for anyone that is 18 and over residing in the home. We do not do credit checks. We do not charge an application fee, and we do not place a lien on the property. We basically want to connect homeowners with these resources. We also work with private donors to help those that do not qualify for the traditional USDA funding. Next slide, please. In 2024, we were able to complete 174 projects across 36 states, which were 144 water wells and 30 septic systems. This benefited over 350 people. Also, as local contractors are used within these communities to do the work, we put over 1.7 million across these rural communities. Next slide. And of course, if you have any further questions, you can put them in the chat, or you can feel free to reach out to us at that contact information there. Or if you know and you want to refer someone to apply, those are the steps on your screen. Thank you.
Wonderful. Thank you so much, Elizabeth. And your flyer for the Water Well Trust will be included in a follow-up email to everyone in the audience today.
Thank you.
Of course. All right.
All right, and up next would have been Steve Wilson. It looks like he's not on today, so I'll cover his
I actually am
info.
on today.
Oh, Steve, you're here. You
There
made
you
it.
are.
All
Yeah,
right, have at it, Steve.
Yeah, I'd mentioned to Nicole I couldn't join till 2, so I've just got on here a little bit. Can I share my screen?
Sure.
It says sharing is not enabled.
Give me one sec. Try it again, Steve.
I sure will. There we go.
Wonderful.
Okay, seeing that?
Yep, just popped up.
Excellent. Yeah, I apologize. I thought I'd mention I wouldn't be on right away today. Unfortunately, I had another commitment. So we run the private well class. It's funded by RCAP through US EPA funding. We're at the University of Illinois at the Illinois State Water Survey. It's a 10-lesson class for homeowners with wells. It's self-paced. You sign up via email, and it sends you a PDF once a week for 10 weeks. We've had over 13,000 people take the class. We also do webinars every month that support those lessons, and also tailored webinars for like environmental health professionals or realtors or labs. And so we've been around since 2013. The URL is privatewellclass.org. It really is, what can I do to help private well owners understand their wells and their water? We do a lot of other things, which I'll try to go through quickly here. So this is our front page. It's just privatewellclass.org. You can find a lot of information there about topics related to private wells. It's available in Spanish. If you work with native Spanish speakers at our well owners, there's a version of this available through this website. We do webinars every month. We just did one yesterday. I think we usually have between 150 and 400 people. This one is from 2018. I highlight this because we had an expert come on that day and talk about all the work she'd done looking at lead in homes with private wells, especially in areas where water may be more aggressive or corrosive. That's all on our YouTube channel. We create a bunch of shared videos or of single videos, 4 to 6 minutes long, about about pressure tanks, shared wells, what's an aquifer, all that sort of basic stuff. And then we have a lot of information available for professionals. One, our class is available on NEHA's e-learning center. Each lesson is worth 1 CE of NEHA credit. There is a quiz at the end of each one. It's also available to ASHI, the home inspectors can go there and take it as well. You don't have to be a NEHA member. You do have to create a login. And so RCAP, I know Andrew spoke earlier, does host workshops around the country through the regional staff, and they do the assessment tools I'm assuming he talked about, so I'm not going to talk anymore about that. We have a podcast called drinkingwaterpodcast.org. It's meant to be at the intersection of rural health and drinking water. So it has guests. These 4 guests are all related to private wells. We just almost finished with our 5th season, which will be 60 total podcasts. 58 of them are out, I think. I think there's one will come out today and one will come out next Thursday. And then next season will start sometime in June. Really informative. They're with experts. Dr. Wolf as the head of pediatrics at Boston Children's Hospital. He deals with issues with kids that end up having issues related to their well water as one of his things. And so he's really passionate about all this stuff, and he's been very supportive. Again, it's on NEHA's webpage. It's free to take once you are registered. And on our page under Resource Library, we have a newsletter that goes out once a month. It's for professionals, not for well owners necessarily. You can check those out. Lower down this page is a list of those. We did a demonstration of sealing and abandoned an old well, an old dug well a number of years ago. And we made a video of that. And so this is just the front part of one of our newsletters. I encourage you to check them out. They're really well done. There's a lot of good information and new materials we find from others around the country. And we list links to all that sort of stuff. We put on a conference in 2017 in person in Champaign. There was 120 some people there from 30 states. We've had several since then, 2019 in Harrisburg, Pennsylvania, and in 21 and 22 that were virtual. We are hosting a conference this May in Bloomington, Illinois, which is only about 45 minutes from us, but it'll be in person. The abstract submission's over. We hope to have the registration up maybe even tomorrow, if not early next week. Encourage you to consider it. A lot of good things have come from the folks attending this conference. It's really for professionals, and it's meant to be, it's not a research conference. It's to take home stuff that you can then use with the well owners you serve. We've recorded every single presentation, even at the in-person meetings, and we'll do that again. They're on our YouTube channel. So if you're not able to travel, you can watch the whole conference and see all the presentations on our YouTube page. So Barb Luukkonen, they did this great study in 3 states where they sent out questionnaires to homeowners, almost 2,700, and she talks about that work. The last thing I want to mention is we have this brochure. It's a trifold, and on the front, it looks like this. On the inside, it talks about getting your well tested, follow these best practices. It's very, very basic, but it's a good thing for someone who may not be considering things. We actually put this together for a local health district or a county health department to keep in their waiting area. It's free to them. We've even left a space so you can put your own label on this. And so we print these and we ship them completely free to you to anybody who wants them. We've had one of the state labs, it's an actual state agency, requested 3,000 of these, and they put it in every water sample result they send back to their homeowners who've had a sample done. We've printed 93,000 of these so far, and in 6 mailings or 6 printings based on requests from folks all over the country. It's also available in Spanish if you, again, work with native Spanish speakers and that have private wells. And this, again, is all available. Just you could go to our website and request it. The last thing, we do have a hotline and help center. On our front page, if you click visit the help center, Sally Dolan and Aaron Huggett manage that. They're here today. But it takes you to this page where you can use this chat bot, which uses all the information that we put in from all of our webinars and all of our events and from our lessons. Or you can call us, or you can search the knowledge base. And if you do search that, it'll come up with answers to about 150 questions that we put in there and have available. Last thing I'll mention, Nicole asked me to mention that we started a website called decentralizedwastewater.org. It's really for professionals in the on-site septic community. It lists all the training around the country, and it has resources from all the associations and players that serve the on-site industry. So pumpers, installers, and inspectors. And that's it.
Great. Thank you, Steve. Tom, I hand it back to you.
Yeah, thank you. Yeah, that touches on, Steve gave a great talk yesterday for his class, kind of on outreach. And it's interesting to see, I think, one of the indicators he mentioned there is that multiple modes is the best mode. So the different ways you reach out. Yeah, so I'm Tom DeBell. I work for the Vermont Department of Health as an environmental health engineer. Today, I just wanted to kind of briefly touch on a couple points that our communication office kind of helped come up with when drafting communication products to ensure that they're accessible and effective. So I'll just be talking through some bullet points. You'll be getting through the email after this talk, a checklist of different accessibility things to look at, and then I'll also just be going over an example fact sheet that kind of implements some of these things. So creating accessible documents, it's really, the effort is to make sure that all the people that we serve, that we interact with, have access to clear, factual information that's digestible, and that can vary a lot depending on who your target audience is. In the case of private water and wastewater systems, our target audience can be really broad. Steve has definitely said in the past that well owners come from all walks of life, and in my experience, that's true. Tons of different education backgrounds. Some people have a lot of expertise, some have not. So trying to find a middle ground of using plain enough language so that's easy to understand for a broad audience. So some of the points, keep it simple, keep it short. I think those are all two really good pieces. One that sounds really basic is just the font size, good use of white space. I know I'm definitely prone to try and squeeze just one more sentence in, make things a little bit smaller maybe than it should be. Really important to consider that maybe not everyone that's going to be reading whatever this resource is, whether it's a fact sheet or an email, is going to have perfect 20/20 vision. So making sure that your message isn't lost if it's too small to read. Yeah, so this is an example, I think, of using some of those points and kind of implementing pictures, infographics in a neat way. Here you can see just kind of using some of these tips from the accessibility guide, using large fonts in the headers, high contrast between the words and the background color, little icons that kind of indicate what each section of the fact sheet's about. I think oftentimes when conveying health information, you have to kind of strike a balance of catching people's attention that this is something they should be concerned about, but not necessarily something that's going to cause fear or panic. So in this particular case, this was a fact sheet we were using to encourage folks to test their drinking water as an outreach handout. And one of the things that you see there is instead of kind of getting bogged down in specific numbers, I think in this case, we found arsenic in 28.7% of wells that were tested. So simplifying that to say, 2 in 5 homes with wells tested high for arsenic in this particular community. And next slide, I'll show kind of the bottom of that fact sheet, if you can advance it, yeah. And then the bottom, we kind of, explain the problem in the first half, kind of get people's attention. The bottom's really where we offer a resolution to kind of the question we pose at the top. One thing for effective communication is really trying to frame it almost as a story. So the first part of that story being, hey, there's this problem. I think in this case, it was with arsenic. Providing a little bit of context, not too much context about, hey, where does this come from? What are the health concerns with this? And then really getting down in the bottom part here, we talk about, what you can do about it. And that's the key message that we want to take home, is that we're encouraging folks to test. Mm-hmm. And then probably the most important use of space is the more information. You're not going to fit all the information you want on every material. So just having a place if folks have extra questions, want to learn more, that they can get that information quickly. And with that, I know we're running short on time. So this will be included in the materials after the talk, and definitely feel free to reach out to me if you have any questions on it.
Great. Thank you so much, Tom. Yes, to the audience, you're going to receive lots of resources from today's session. So as we come to a close, I would like to thank all of you for joining us today. And I would like to give a special thanks to our guest speaker, Amanda Goff from the Tennessee Department of Health. Thank you for a great presentation, and to Tom DeBell for putting together a great resources session today and sharing great tools from Vermont. To our partners who came today to share a bit about how they contribute to our field and the resources they have available, Elizabeth McLean, Charlene Bean, Andrew Nordby, and Steve Wilson, thank you. And to our Private Water Network work group on the back end who helped bring this event to fruition, James Retta, Mary Beth Brown, Diana Rashash, Raquel Sabagel, and again, Amanda Goff and Tom DeBell. I would like to ask each of you who joined us today to please take just 5 minutes at the close of the seminar to complete the evaluation survey, which you'll receive a prompt for it right at the closing of the seminar. We would love to have your feedback and ideas as we begin to plan for Open Forum number 2, which will be held during National Drinking Water Awareness Week on May 7th at 3 p.m. Eastern Time. All of you will receive invitations as we get a little closer to the date. And lastly, if you would like to submit for CE units for attending today, please email me your request for a certificate of attendance. And again, thank you all for being here. Your dedication to the field of private water and on-site wastewater are much appreciated and valued. Have a wonderful and great rest of your day. Goodbye.